My name is Jack Lamphere. I am in PS 240 Developmental Psych and in Section 3. I've done my project on the development and change of attachment styles. This project, I initially wanted to go over just the change when it came to categorizing Bowlby's attachment theory, covering how and why attachment style would change from the four attachment styles: secure, anxious, avoidant, and disorganized. When it came to the topic, I found myself most intrigued this more personally than I often found myself, particularly in this class, seeing in my studies and the implications I lived or was living through. It was really nice to be able to understand it, especially while my going through the content. I also found I enjoyed understanding personal relationships to find a better understanding to my own logical brain. In later findings, things were much less linear. This field's also relatively unresearched. Not only did this theory only begin in the 1950s, but more importantly, actually tracking and finding the specifics to the development in attachment is pretty difficult, because not only does change require exclusively longitudinal studies, but to add on, and there's a lot of different factors to track when it comes around to attachment styles, and it's difficult to really track attachment, especially from a young person, and it's even harder to tell how an attachment style will later influence something decades in the future. The base of the base of this field and how things occur require understanding of the basic fundamental of Bowlby's attachment theory created by John Bowlby. At its fundamental level, it helps define how people in their core default to dealing with social emotional bonds with others. In his base finding, he found how kids usually create the styles in their first few years of life. To add to the theory, how the theory had a lot of fundamental creation styles, which were kind of weird, and they're made very young and often subconsciously. And it adds to that difficult tracking where a lot of kids don't even realize that they are creating an attachment style, even when they get into their elder years, including like middle adolescence. When it goes into the specifics of the four different attachment styles, the base and most positive attachment style is secure. The child in this environment has little to no worry when it comes to the love and their parents in their own household. It also tends that household's pretty consistent. This style is based around honesty, tolerance, emotional closeness, and rarely displays struggles around independence. The latter three are strictly result from a more negative or lack of need from the child's part. An anxious attachment style particularly happens due to a lack of some type of figure or some type of abandonment at a young age. They often hold high levels of anxiety and low self-esteem, and an inverse relationship, often putting other people on a pedestal over themselves while they still hold a fear of abandonment. An avoidant attachment style is created mainly from an inconsistency from their caregiver, where their needs are sometimes met but sometimes aren't. They often hold a very strong and often unhealthy level of independence, where they reject many feelings of being attached to other people and often don't want to depend on or be depended on emotionally by other people. And often when they get stressed, they get very closed off and retreat more into their independence. Disorganized is arguably the worst, and it's a mix between both avoidant and anxious. Um, these often come from high levels of trauma, such as physical or emotional abuse, and can even spring after particular traumatic experience, such as sexual assault. Um, to find these theories, in Bowlby's study, he ran an experiment where he measured the reaction between both the presence and the absence of young toddlers' parents being in the room. There were four major reactions, which link with the four different categories. One involves the kid exploring the environment and playing with toys, whilst in the presence of their mother. And after they left, there was a mild protest, but not a lot. And after they returned, the kid promptly came to their mother and resumed a positive connection with them, often physically, before returning back to playing, which matches with the secure attachment style. For the avoidant one, with the parents' presence or not, the kid showed a very little interaction with their parent. They still explored the room, but both with the parents' presence and after they left and returned, the kid paid little mind to them. With the anxious attachment theory, it was quite the opposite. They were very clingy and didn't explore or play with any of the toys in the room. But also at the same time, when the parent tried to engage in closeness, they often pushed back. After the parent left, they showed a protest with crying and screaming. After the parent returned, they were very clingy once again, but stayed in the avoiding closeness with their parents. And for the disorganized attachment style, it was again a mix of both the anxious and avoidant responses. However, it was mildly different, where kids in the experiment were described to be dazed and confused, with a strong fearfulness permeating the kid. Specifically, and most notably, the symptoms were increased whenever the caregiver was around. Bowlby's attachment theory, like most older theories, were heavily relational, or were heavily impactful to its field, but it did hold some flaws. The biggest one being it lacked plasticity. As more studies were done, researchers found how not only would styles ebb and flow based around more the influence as the infant grew into adolescence, they were a lot more plastic and nuanced than originally considered, and a little less global, and while staying within attachment styles, they're a lot more individualized. Resident finding found that while the main attachment style fitting in within one categories remained effect, there still exist domains within the categories based on who the person was or the individual. And it broke into three different domains, being parental, romantic, and peer. Furthermore, the domains continue to expand, adding nuances between people. And in Fraley's studies, he separated the mother and the father for parental, the current and ex-partner for romantic, and best friend and work friends for the peer domain. Through Chris Fraley's studies, who is a psych professor, around his attachment styles, he created a test running around the different figures in one's life, tracking both anxiety and avoidance. They found not only how not only did a person treat someone differently, but often at times contradicting their attachment styles based on a role of that person in their life. But furthermore, a difference was found within the same role, showing how a mother and father would be treated differently despite a consistent attachment style overall. Um, in the first study, um, the study's title was and the association between childhood experience and adult orientations. Um, the goal initially was intended to fill the gap between which existed as kids exited childhood and became an adult and began to live independently. The study tracked 1,362 children from their first month to about 15 years, where they were collected. They were collected and located in hospitals next to research centers in 1991. With the first portion of the studies, the kids were examined around their impacts in early childhood. The other relevant factors of the child's social, emotional, and cognitive development, as well as their own physical health. After the human development study of early childhood care and the youth development, which is known as SECCYD, it was then later picked up by a different organization. But within the first few checkups, which were done in 2009 and 2018, as well as another one in 2022. During adulthood, 751 of the participants were still in the study, and at that time they were checked at 20. They were between the years of 2016 and 31. In the direct tracking of 4 different general attachments were tracked. Mother figures, father figures, current romantic partner, and best friends were tracked throughout this study. Each category was broken into 9 questions where the participants rated from strongly agree to strongly disagree. 6 of the questions measured attachment avoidance, and the other 3 measured attachment anxiety. Using more periodic questionnaires and filming their reactions in the process. These included parental sensitivity, conflicts, closeness, warmth, hostility. With friends and romantic relationships, it includes friendship quality and social competence, and the tracked childhood demographics. Furthermore, the childhood's demographics were also tracked, as including their social emotional status, maternal education, race, and sex at birth. The results from the first study had a lot of different findings, with some relative exceptions, but in general, they were fairly intuitive to the thoughts. The descriptive statistics of this study is being shown through are very comprehensive, yet have some strong correlational results. Within the parental domain, a mother, the general finding was that the more sensitivity from the maternal figure will lead to decrease in attachment anxiety and avoidance. Furthermore, an association with earlier maternal sensitivity shows a strong attachment anxiety with the mother than compared to a best friend. The findings with the mother continued this trend where less conflict and more closeness reduces these factors. In situations particularly found in adulthood, relationships with higher attachment anxieties find the child relying more on the father figure for problems, and most of these findings were true vice versa. However, father figures are actually quite different from the mother, where their closeness didn't particularly correlate with their attachment orientation for the kid, where overall closeness was not a predictor later in life for the father. Paternal hostility did show an exception where when the child was in a hostile environment, it worsened the general attachment anxiety, but not anything specific towards the father. Overall, the assumption of attachment theory is true, where there are many different variables which modify the attachments, and the findings are fairly similar and would be noticeable through common sense, such as increased closeness with a mother has lower anxiety and attachment. To continue on the studies, more early and social experiences increase competency as an adult, where while the study was conducted, there were a few missing holes in it. Better genetic and cultural diversity would need to be added to get a more complete picture of how different cultures could impact a child's attachment style development. There's also not a lot when it came to finding of early romantic relationships due to just poor findings and no direct correlations. Also, due to how the study is, society has changed a lot more, even compared to 1991, where due to the cohort effect, it might not particularly apply to nowadays kids. Where in the future, the overall generators of the attachment theory are true, where early childhood and adolescent experiences set a baseline for the rest of your life. However, there are a lot of different subfactors which impact one's attachment style and change its nuance, which continues to develop throughout the child's growth and continues to impact their decisions as they grow up. In the second study covers the stability and change in adult attachment style. And its goal is to understand how its later influence will affect relationships in social behavior, cognitive processing, and risk factors. Oh, sorry. This study covers a few ways of understanding and translating the relevance of attachment style and its change at this age. The study tracked 174 economically stressed mothers of infants with a total household income of around $41,000 to $45,000. When the study began, only about 162 of which provided attachment data for the first time. Moms ranged from 18 to 39 years old, with an average age of about 24 years. At the first examination, 80% of mothers were in a committed relationship, with a majority of them being Black mothers. The data was collected at 5 different times, at the child's age of newborn, 6 months, 12 months, 18, 20, and 24 respectively. During the first visit, mothers were given questionnaires of their demographic information and a self-report of their attachment style, as well as their perceived caregiving from their own mother and from their romantic partner. Furthermore, questions were added on using romantic relationship quality, social support, and overall psychological distress. At 16 months, the same questions were asked, plus a measure of their depressive symptoms. And then in the later 3 findings, the mothers came into the lab for checkups rather than just taking a questionnaire, with some additions to the questions, adding depressive symptoms, asking about the romantic relationship quality again. But in the visit involving the child's second year of age, the questionnaire was not held. To go into the particular findings of this study, after the first visits, 3 mothers dropped out of the program, and the ones which dropped out were generally older. In the newborn visits, the anxiety ranged in the mother, while it was also found that stability was lower and more distal between visits. No continuous decrease was found in stability, however, leading to largely minor and neutral changes over the course of the entire experiment. The results were also used to compare the prototype and revisionist models of the psychological thinking, and it was used to be characterized and understand attachment and stability. For both avoidance and anxiety, the prototype model for psychology was much more accurate, showing strong patterns of stability across all waves, and the general finding showing how the first few years of new motherhood and the child were especially vulnerable to increase of heightened emotional variables and social upheaval. The limitations of the study were quite plentiful. The majority of mothers were economically stressed mothers of color. But this isn't the worst limitation due to the overall lack of African Americans in much of the research field. Also, due to all the mothers being first-time parents, there is a strong dysfunction cannot be made about the attachment factors for new parenthood. Only correlational conclusions could be made about that. And the attachment insecurity is the only one of the depressive symptoms in early parenthood. I also found a particular struggle with this study, because while it does track the parents' attachment style, it also partially tries to check with the newborns as well, and the reverse engineering of both the patient's attachment style to understand the newborns, as well as there was a lot of personal questions, and with questionnaires, it can vary based off of the questions leading to different responses. To overall conclude, my overall conclude and understanding how developmental changes. The field's really weird because overall, this field is very difficult to get information out of, where longitudinal studies are the only real way to get a actually substantial study and information out of the change and development in attachment styles. Furthermore, there are a lot of different things to track, which add to the complications of finding the attachment style, where they need to track, and it's very difficult to actually find and track an attachment style using kids which are so young. Further, overall, though the findings were fairly consistent across overall, the core attachment style rarely changes, especially when we pass young adulthood. Attachment style is made very much in young adolescence, where personal experiences more modify the attachment style rather than have a real strong impact which could change the attachment style, leading to more changes in domains than changes around the 4 core styles. If I want to add further on into this field, the main way would just be continue tracking longitudinal studies, as there's not a lot done even still in tracking new parenthood or the growth into parenthood, as well as beyond that into middle adulthood and later on. So if I were to continue and add to this field, I would continue to push the current longitudinal studies to track how they would change further into the future to see if anything changes later on in life, especially as often roles between parents change as age continues. I thank you for participating in my presentation about how attachment styles change and develop.